Hello, I'm Dr. Pat Bona, and I'm here to share with you conditions that humans have that I find in horses as well. Patients come into me on a regular basis with rotator cuff injuries. That doesn't mean that you're an athlete and you hurt yourself by pitching too many innings in a game. It can be the fact that you have poor posture and your posture puts stress and strain on your rotator cuff muscles. The same thing can happen to horses. They have changes in posture because of saddle fit, because of shoeing or hoof balance, because of injuries. What we want to do is look and see how the horse might act if they do have a problem with the rotator cuff. People present to me, not the fact that they can't move their shoulder, it's the fact that they have headaches, they have neck pain, they have trapezius pain, and they have stiffness in the neck. And when I evaluate the neck's not so much the issue, it's the fact that they strained the muscles of the rotator cuff. Primarily in people, it's supraspinatus, also infraspinatus. The other two muscles in the group are the subclavian, subscapular, and the teres minor. With horses, I find it's mostly the involvement of the infraspinatus. Clients might tell me that the horse won't bend, that they're stiff. I, as a practitioner, might find that they have difficulty bending their neck. Or if they do bend their neck, very good. He's doing a pretty nice job for an older horse. He's bending his neck and he's standing nicely with his weight on that forelimb. You might find if you get the horse to bend his neck that they end up weighting the opposite forelimb because they don't want to put any muscle contraction or stress on those, the fascia and the soft tissue of the rotator cuff. I started to look into this because I was working too hard trying to even palpate some horses' necks. So I like to work smarter, not harder. So this is one of my first scans that I do on the horses. Of course, I want to go ahead and check and see if there's any predisposing fascial issues of dents in the shoulders if it's a new horse to me, or any trauma, scar tissue, dents up in the withers, in the shoulder, even in the forearm, dents and dings. Once I found that's all clear, I'm going to go ahead and palpate, and he might get a little uncomfortable when I palpate through here. We want to find the spine of the scapula, and we're going to palpate down into that infraspinatus muscle. And he's a little reactive here. I'm actually pulling on his withers, so I can kind of keep him steady and see how things are feeling for him all the way down through there. I can go on the top side of the scapular spine, and he's a little sensitive there. Yeah, good boy. On the supraspinatus muscle. So you want to pay attention to the muscles as they're integrating with that spine of the scapula. I'll use my tool so I can get a little bit more specific along that bone. We go ahead and release, and again, short strokes. Cross fiber is always a good way to start. I'm coming along the edge of that scapular spine. Good boy. And he's having a nice response there. Stretching down. Now I'm going to go across the infraspinatus a little bit deeper. We want to feel and see some muscle definition. We want to know that those muscle bellies can go ahead and move and glide next to each other. So that's the reason why I go to the spine of the scapula. I can go to the front and make sure that the supraspinatus and the subscapularis are freely moving between each other. And this subscapularis is a little tight and restricted. Feels like there's some little adhesions around the brachiocephalicus that I can release, because that's going to affect the stability and mobility of that glenohumeral joint. To avoid any other compensations and get that rotator cuff muscle functioning as optimally as we can.